Hi, happy morning, everyone. Welcome to Metier YouTube channel. I hope you are all fine and preparing well for your upcoming nursing competitive exams. You all know that Metier are conducting the classes, the 3 months base, 6 months base, and 1 year allied program also. So kindly utilize the class and study well and get your job. Okay. Daily we are posting a very important MCQs as a topic for the nursing competitive exams. Today also we are going to see important MCQs to start before start the class, we'll start with a small quote. Start where you are, use what you have, do what you can. Okay. Wherever in the position, sir, you're telling that sir, I'm only 10% know about the subjects. That's okay. Start from that 10%. Sir, I know I am 1%. I know that. Start from that. Whatever you know, which percentage you know that, which percentages you are from there, you have to start your progress. Okay. Use what you have. Don't buy more and more books. So what are the books you have already? And we are uploading some YouTube videos like that. What are the materials you have? With that, you can prepare. So otherwise, you can join some classes also. Okay. Do what you can. So this much only I can do. Okay. But the step, the progress, that is depends upon you. Okay. Start where you are, use what you have, do what you can. Okay. Starting is very, very, very important. Okay. We'll start today's session. Today we are going to see Parkinson disease related questions. Okay. Parkinson's related disease questions. Okay. First question. The nurse is assessing an older adult client. Which finding should cause the nurse to suspect the client has Parkinson's disease? Select all that apply. So the options, the client has hand tremors at rest. The client does not remember what he ate for breakfast. The client's blood pressure increases when the client stand up. The client has a slurred speech. The client's facial expression shows no emotion. So what are the symptoms the Parkinson patient can have? So the correct answer is option A, B, D, E. Except C, all the answers are correct regarding the Parkinson disease symptoms. Why C will not be there? There is a postural hypotension can happen. Here they given the increased BP. It is not present in the Parkinson disease. Remaining tremors at rest, and the client does not remember what he ate for breakfast. Okay, a kind of amnesia, and a client has a slurred speech, definitely will be there, and client facial expression, lack of facial expression, the mask like face will be there. I'll show the image. So these are the important signs and symptoms of Parkinson disease: mask like face, rigidity and trembling of head, reduced arm swinging, forward tilt of trunk, rigidity and trembling of extremities, shuffling gait with short steps. Cog-like wheel. You can see this is a cog-like wheel. It is rusted. It will move very slowly like this. Okay. So like that only the patient will walk. Okay. These are the important signs of Parkinson's disease. Next question. Which is the main pathology of Parkinson's disease that causes changes in muscular and sensory function? So the options: reduction of acetylcholine in the brain. Option B, reduction of dopamine in the brain. Genetic predisposition, and presence of Lewy bodies. So what is the correct option? So everybody knows that it is related to the dopamine. When the dopamine levels are reduced in our brain, when the supply is reduced, or the production is reduced in the substantia nigra, what will happen? Our body will develop a Parkinson disease. Not only that, 15 to 25% genetic also can causes the Parkinson disease. But the question, you can see it here, main pathology. So the main pathology is reduction of dopamine. Okay. And presence of Lewy bodies also can lead to Parkinson's disease, but it is mainly related to the Alzheimer disease. Okay. And acetylcholine, myasthenia gravis, as well as Alzheimer disease also is related to acetylcholine. So the main pathology to the Parkinson is dopamine reductions level. Okay. Yes. Next question. Which clinical manifestation would be required to confirm the diagnosis of Parkinson's disease? So the options: tremors at rest and bradykinesia only, rigidity only, tremor at rest and flaccidity. So this is a recent examinations question. Okay. So what is the correct option? The correct option is answer A. A diagnosis of Parkinson's disease required a presence of 2 or 3 cardinal manifestation. What are the cardinal manifestation? Tremor, rigidity, and bradykinesia. So these are the 3 cardinal manifestation of Parkinson's disease. Among these 3, if 2 is present, we can confirm the Parkinson's disease. So here 2 diagnoses are given, 2 manifestation given in the option A: tremors at rest and bradykinesia. Okay. Not only bradykinesia, not only rigidity will not confirm the Parkinson's disease. Okay. Tremor at rest, okay, but placidity won't be there in the Parkinson's disease. So option D also wrong. So the option A is the correct answer. Got it? Yes. So next, which symptom for a client with Parkinson's disease is due to the lack of automatic muscle movement? Okay, the automatic muscle movement. Diminished voice volume, reduced ability to swallow, alteration in the sleep pattern, diminished physical mobility. So listen, little tricky question. You have to read the question very carefully. Don't see only the Parkinson's disease. There is a key point here. Automatic muscle movement. Automatic. Okay, that means involuntary. So if you see the options carefully, option A, B, and D, are these 3 options are voluntary muscle movements except C. C is an alteration in the sleep pattern. In sleep pattern, our muscles will go to the involuntary stage, right? So the alteration in the sleep pattern is related to the loss of muscle coordination in the automatic, that is involuntary. Got it? Yes. So remaining A, B, D and all voluntary related. The question is automatic muscle movements, that is related to the alteration in the sleep pattern. Okay, next question. Which type of therapy is used to manage problems with eating and swallowing when the patient is having a Parkinson's disease? So normally, if you're not only Parkinson's disease, normally when the patient is having eating and swallowing problem, the which therapy is required? Physical, occupational, speech, and nutritional. Okay, so the right answer is option C. That is speech therapy. Speech therapy is to manage the problem with eating, swallowing. We thinking that speech therapy means the patients who are having a problem with speech. No, they will teach how to swallow, how to eat. Okay, which muscle we need to use when you have the paralysis in the some kind, some facial muscles. Okay, so the speech therapy people will help you to treat with the problem with the swallowing and eating. Occupational therapy is maintaining for the self-care activities after the stroke, after the Parkinson's disease. Okay, how can to do the self-care activities? Okay, physical therapy for the coordination of your balance and gait and muscles. Okay, there is no particular nutritional therapy is required for the Parkinson's disease. Okay, okay, the answer is option C, speech therapy for the eating and swallowing. Okay, that's all about today's session. Thank you so much. Please kindly subscribe our channel. Okay, so that we will get motivated and we'll put more videos. Thank you all. We'll see you in the next class and all the best.